Thank you, Sheena. We've seen what's happening outside, but tonight we're getting one man's unique perspective of the climate inside Rhode Island Hospital during the strike. As we reported, the hospital spent $10 million to hire thousands of temporary workers.
Tonight we're talking to an East Providence man who was there as the transition from nurses to replacement workers happened. And he tells us his experience has him concerned for patients' well-being. Eyewitness News reporter Caroline Goggin joins us now live in studio with a story that's new tonight. Caroline?
Well, Mike and Shannon, the Department of Health says throughout the strike, its priority is to monitor both hospitals to ensure that the facilities are providing safe, quality care to patients. But one patient who was inside Rhode Island Hospital just before the strike began says there was a lapse in that care.
As nurses and technical staff prepared to leave Rhode Island Hospital on Monday, they also got ready to leave behind their patients, like Peter Tsonos. He had undergone an emergency tracheostomy, and after a week-long hospital stay, he says he wanted to get home.
The nurse said, I just want to make sure you can eat all right, and then, you can get through the paperwork and get you discharged.
But Peter says she never came back. He tells us he was then informed the nurses had been escorted out and that the temporary ones were coming in.
It was like a ghost town. It was deserted.
And he needed help.
The secretary came to the room and handed her some papers and said, well, I've never discharged anybody before, so here are your papers. And I said, well, do I leave now? And she said, I guess so.
So Peter went to leave, but as he made it down the hallway, he says he realized he still had 2 ports attached to him. He sent us these pictures as he waited by an empty nurse's station. Someone eventually helped him, but he says he left the hospital concerned for the well-being of other patients who were still being cared for.
And the poor patients that were still in their room, and I mean, how are they getting help?
But the hospital says those patients are in good hands. President Margaret Van Bree tells us the transition Monday went very well and that the hospital has competent people filling in. The Department of Health echoed that statement, saying both Rhode Island and Hasbro are functioning safely and appropriately.
Peter is a former teacher, so he told us he understands what the nurses are going through and he supports them in this strike. He says one of his nurses was in tears over the weekend because she felt terrible for leaving him. I'm Caroline Goggin, Eyewitness News.